Okay. Okay. All right. It is 12:05. We'll call the meeting of the Criminal Justice Coordinating Council meeting to order. Could we have the roll call, please?
Kathy McCoy,
Present.
Bill Trepanier,
Present.
Mark Helwig,
Here.
Grant Gerber,
Here.
Andy Alvarado,
Here.
Mike Bowler,
Here.
Tweed Schuman,
Here.
Doug Rotek,
Here.
Bruce Paquette, Katie Bellinger, Stephanie Thomas Schmidt, John Yackel, Monica Isham, Elaine Smith, Marshall Savitsky, Julia Lyons. Let's count them up here. You have 9 out of 16.
Okay. So we do have a quorum. If you would join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And do we have certification of compliance with the open meeting law?
I will do that. And before I do so, could I ask a favor to everyone pull their microphones very close? We've been listening to the Zoom meetings and they've been very hard to hear. So pull those microphones in. This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, thank you. Next thing would be meeting agenda. It has been set. Is there any reason to reorder anything for anybody's convenience, or are we good?
Good.
Everybody's okay? All right, so we will move on. Consideration of approval of the minutes from the previous meeting. You all should have them, I believe. Oh, I'm sorry. I missed public comment. Thank you, Tweed. Is there anybody in the audience who'd like to make any comments on anything that's on the agenda or just in general? Okay. Then we'll move on to consideration of approval of the minutes of the previous meeting, November 8th. Does anybody have any corrections, changes?
I move to approve.
Okay, I have a motion to approve. Is there a second?
Second.
Okay, I have a motion and a second to approve the minutes as printed. All in favor?
Aye.
Opposed? Motion carries. Bylaw review regarding circuit court judge voting privileges, discussion and possible action. I was just reviewing this with Lynn. I think we did take care of this back on January 11th at our 2023 meeting. There were motions to add the new judge and to have that new judge be a voting member. I think the bylaws that we are looking at just were not updated to reflect that. I think Judge Yackel, you were here and you were the one who actually made the suggestion that we should get them on because we had 2/3, we had the necessary people that we have a hard time getting for the majority, supermajority quorum. And it does say very clearly that we added a Health and Human Service representative, and we also added the tribal judge that we edited that judge, the tribal judge remain, it wasn't in the original ones, that she was a voting member or he, and we added the second circuit court judge to be a membership listed in the bylaws. So I think we just need to update the bylaws. I think they are both on the committee. And we'll go over it, Lynn. I think I see where the glitch is. So I don't think there's any, I don't think there's any action required. I think we need to just review it and update them. I don't think there's any action because it does state very clearly in the minutes, Tweed, you made the motion. I mean, that those people were added and they were added as voting members. So I don't think, I think we just need to get them updated. So anybody else, any comments or I think we're good. And I can talk to Lynn, I talk to Andy and we'll get that corrected then. And maybe we'll put it on next month's agenda just for review, basically, to make sure that everybody's clear on it. Okay, so then going on, we have jail report.
Thank you. The November 23 jail report, as you can see, numbers are holding steady. We're still down from our year-to-date average, which is 71.49. November population was at 67.75, 22.25 females to 45.5 males. Average probation incarceration is at 14.5. Pre-sentence incarceration was at 37. Average sentence incarceration was at 16 and a quarter. At the time of this report, we currently had two out on electronic monitoring and one working Huber. Unemployment rate was increased this month. It was holding steady, I believe, around the 70% mark. We were at 84% for the month of November.
Well, thank you. Half of it looks good, half of it's not so good, right? Unemployment continues to be a big problem, obviously.
Something that we did want to share, we are looking at changing the way that we run Huber at the jail. We're looking at potentially putting anybody that's Huber eligible with a job instead of working Hubers in and out of the jail out on electronic monitoring. We're looking at possibly moving forward with that effective January 1. We're still working out some policy and procedures. We've been working with Justice Point, our Huber officer, some neighboring counties to see how they're running their operations without trying to reinvent the wheel. So,
Right. That sounds like that'd be a great idea. Maybe encourage more people if they didn't have to go back and forth.
yep, I agree.
That was going to be my question too, Mr. Waller. How do you justify a full-time position Huber officer for one inmate on Huber? Correct?
Well, the Huber deputy is part of the court services. She has multiple tasks. She's filling in the courtrooms, courtroom security, anything that goes on within the court services division. So that task is not just the Huber officer, I guess you could label it as. It's part of the court services division. So.
So the question, from my perspective, I would ask it a different way. If you're going to be having Huber with the ankle, and then will that Huber officer then be available to direct a lot of their time to more of the court services?
I would say more time. I wouldn't say, I can't.
Not exclusive, but
Exactly. Yep.
but there would be more available because we know that.
Please, if you're gonna speak, use the mic. Thank you.
We're sometimes stretched thin on that as far as having somebody available. And if the Huber is being with the ankle monitoring, I know that doesn't fix the problem, but it helps it, I think, a little bit, at least from the court's perspective.
Yep.
Am I wrong, or is it?
No, you're right.
Okay.
I'm just wondering, how many potential people do you think are?
I have our Huber deputy here. I don't know if she could step up. I mean, currently, what do we have that are Huber eligible?
Hello. So currently we have about 15 inmates that are sentenced, which means they are Huber eligible. But of those, we have 3 that are on the electronic monitor. One of them is on in-house Huber currently. The others are set for release within the next coming weeks or days, which we're not going to work with them on getting them out on the electronic monitor because it's just not time, or it's time consuming, I guess. Some of the benefits that I believe for going straight to electronic monitor would be eliminating contraband to a point, I guess, from having those in-house Hubers when they return back to the jail. We've had one incident on that already. And the inmates get to go home at the end of the day, which in turn, prepares them for when they're actually released from incarceration. Do you have any other questions?
No, thank you very much. I appreciate your work.
Thanks.
Anyone else have any questions on the jail report or? Okay, thank you, Mike. We'll move on then. Criminal Justice Coordinator. I think you've got some statistics for us, correct?
Okay, I'm going to go through a few different things. So I'll go through our regular numbers. Right now on pretrial, we have 134. We have 33 on court reminders only. We have 12 on diversion. We have 19 diversion referrals pending. I have a breakdown of that. We have 10 of those referrals came from the district attorney's office. 2 of those referrals have assessments that are scheduled to be completed. 2 of those have already, those assessments have already taken place and they're pending admission. 8 of those referrals came from the pre-screens that are done upon arrest. And then we have 2 that are waiting for court-appointed attorneys. We have 8 diversion cases that have been completed. And then there is a discrepancy in the email that I sent you. We have 6 diversion cases that have been terminated. And I know there was some confusion last month about failures and terminated. They are the same thing. We're just using the word terminated. So we have 6 that have been terminated. So we do have recovery court referrals that are coming in. We have 8 referrals and 1 that has officially been accepted according to our policies and procedures. On our wait list, we have 5 and 4 of those are incarcerated. We have 8 intakes pending, or I'm sorry, 9 intakes pending, and 7 of those are incarcerated. Does anybody have any questions about the numbers?
You said how many were waiting for attorney appointments?
2.
2. That's what I thought. Thank you.
Yep. Okay, so if nobody has any questions about the numbers, if it's okay, I'd like to update on.
I guess I got one question.
Okay,
The recovery court referrals and accepted, is that at the tribe or county court?
that
The
is,
tribe, right, Bill, would have a healing to wellness court and,
I don't have the numbers from the Healing to Wellness Court.
okay.
That's from treatment court. Okay, so were you able to send that out or did I send that to you too late? Okay, so I sent Lynn our updated numbers as of today, and along with that there was a link. In that link, there is an application and a notice for, it's through the Bureau of Justice, and it's a COSEP. It's Comprehensive Opioid Stimulant and Substance Use Program. It's not a grant. It is, I also handed some out. Did everybody get one? So it is a solicitation, not a grant. I just want to make that clear. But it is an implementation planning team effort for 2024. And I have a team in place to go ahead and the application is due on Friday. And after 2024, under the direction of the Bureau of Justice and a coaching team, we would be eligible to apply for funding for a grant. It would be like a crisis intervention training grant, which would allow us to pursue, it would be like a collaborative crisis intervention planning model designed to aid law enforcement officers in their response to citizens experiencing crisis due to mental illness, substance use disorders, or cognitive delays, which is something that we've been working toward all along. but we have to have our multi-level programming in place, and this would help us get there. So we have our pretrial, we have our diversion, we have our recovery court, we have our law enforcement deflection, which I will talk about in a minute, but this will also help us get there. And again, this is not a grant. This is an implementation team effort, but it's 1 year of planning under the guidance of the Bureau of Justice. And it's a great effort and a great option for us. I have a letter of support that we wrote, and I would love signatures if we can get them.
Okay, I think.
Does anybody have any questions about it?
I just want to say that I think this is awesome. I think that this is a really good step in the right direction, and I appreciate your efforts. And I will absolutely sign.
I think actually it'd be in, we could have a motion to the effect that we're in support of this, and then everybody could sign it unless for some reason you choose not to. So.
I would very much appreciate that.
I have a question on that, and maybe Mr. Alvarado, are you there? If it's not identified as an action item on the agenda, can it be voted on today? Mr. Alvarado?
I think it's a letter of support, so I mean, I think that's all right. We can authorize the application outside of the CJCC.
Sounds good. Thank you, Andy. So if so, I would entertain a motion in support of this solicitation.
I'll make that motion in support.
Is there a second to that motion? Who is that? Okay, so we have a motion by Tweed and a second by Mr. Yackel. So any further discussion on this? If not, all in favor?
Aye.
Opposed? Motion carries. And if you want to pass it around, everybody could sign it. That would be wonderful.
It's coming around.
It's already coming. Great. Thank you.
Okay, thank you very much. I do have some other updates. Our TAD application for 2024 was submitted on December 1st. The DOJ did send it back to us with requested revisions, and we submitted those revisions on the 7th. They were budgetary revisions, and they were based on our breakdown in our budget, which years past, because we're contracted, we would submit our budget in eGrants and then an Excel breakdown, and that was acceptable under a state grant, but they're now running under federal guidelines, and so they asked us to break our budget down differently. So that was what the revisions were based on, basically. So when we submitted our revisions, I inadvertently deleted the fringe benefits out and had to send another revision through. So those are submitted, and we have not gotten it back right now. So I'm hoping that it's done. So that's where TAD is at. Law enforcement deflection, we still have not gotten our funding. So that was supposed to start July 1st. However, DHS is still way behind, but we did host a training to implement that process on December 6th and 7th. Sheriff did ask that we try to implement it as soon as possible because he doesn't want to lose momentum. Thank you. From law enforcement learning what their role is. And I appreciate that very much. And I would like to be able to do that. The problem is that with the role of the certified peer support specialists, we don't have the funding to cover those. And there is a response effort that has to take place for law enforcement to be able to call them. So I am hoping that we get that funding very quickly.
Well, I just have a question related to that. So have we been approved for the funding? It's
Yes.
just a delay in getting the money to us?
Yes, everything is approved.
Okay, so I'm assuming, I mean, the county has lots of different pots of money. And if it's been approved and we know we're gonna get the money, I don't know why the money isn't just being used. Cause it's money in, money out, and it's all within a budget. So that doesn't make any sense to me why we have to delay doing the implementation of this if we know that the money is already in, is there. I don't, doesn't make sense to me, I guess.
Kathy, let's let Andy comment on that.
That would be great.
Yeah,
would
I don't,
appreciate
I
that.
don't think we've seen a contract, so I don't know that we want to spend money if it's not going to be within the time frame of when we can recover the expense. I don't think it's, and I should clarify with Becky, I don't think it's about the money. I think it's about the contract and the terms of the grant agreement.
Okay, so it's worth reviewing to look and make sure that, so you're saying that, doesn't the contract have a date that it runs from such and such date to such and such date? Or you're saying that the contract isn't really in place yet?
That's what I believe. The contract's not in place, but like you said, the contract would have the dates in there.
Okay, so if the contract is in place though, and it does have the dates, then there wouldn't be anything to prevent us from moving forward, correct?
Correct, because I think this grant, like others, is not a, like, here's the money. I believe it's a reimbursement once we show that we spent it.
Okay, so is there any way we can check and make sure that that contract isn't in place yet? I mean, so we don't delay this if we don't have to?
Yeah, we can check on that.
Could you check on that just to be
Yeah.
sure? Okay, I would really appreciate that. That would be great.
Actually, Sheriff, have you seen the contract?
Yes.
He signed it.
Yes.
So we'll review the contract and see if we can move ahead then. There shouldn't be any reason to wait.
Right, because a lot of times, once the contract dates are in there, it doesn't matter. You don't have to wait to, spend the money, right? So,
Right.
okay, that'd be wonderful, because I hate to see the momentum lost on this, like the sheriff said, and moving forward, right? Okay, anybody else, anything related to that? All right, Becky, you have any more additional things or?
Just that recovery court is going very well, and they actually have a meeting today at 1:00.
Okay, and that was one of
um,
my questions. What kind of wait list are we looking at for that recovery court at this point?
There is no wait list with recovery court. They have those 8 referrals pending, so they just go through their approval process with those.
Okay, and is there capacity that that court can handle?
There is a capacity, yes.
And
They are, I think it's 6 to 8, the first 4 to 6, the first 2 months, 2 to 3 months.
okay, all right.
Mhm. Yes.
Question. Becky, do you have any concerns with your satellite office at LCO?
Any
that working out?
concerns with
Yeah.
it?
Anything else you need or?
I would say one of my concerns is that we don't know when the tribal office is closed. I have asked to be notified, like on inclement weather days or on like tribal holidays, because we have days where my staff will show up and the tribal office is closed. And I haven't been notified of that. But I don't get a response when I ask to be notified.
You got that, Bill? We can take care of that.
And that's
All right, thank
and
you.
that's concerning. Or if it closes early and they come out and everything is dark. And that's concerning too, because that's a liability.
Well, that's rare, Becky, but
It is rare, but it has happened.
okay,
And that's
yeah.
a liability if they're
Thank
in
you
there
for
with
letting
the
us know,
client.
though. Yep.
So other than that, no, it's wonderful because it helps increase the attendance for participation.
Okay.
Okay, does anyone else have any questions related to Justice Point? Thank you, Becky.
Thank you.
Moving on, Health and Human Service Report. I think Joyce, you're filling in?
No. No, Julia was supposed to be here. I'm not sure what happened. So I don't have the whole Health and Human Services. I just have the substance misuse portion of it. We haven't done any further presentations. We have more scheduled for January, so I'm not going to go through any of those numbers. However, some of the exciting news is School Pulse. So if you remember, School Pulse is the texting program that we got instituted in each of the schools. And it sends the kids text messages that are supportive and give them information, but the kids can also text back and ask questions and ask for help. And so at LCO school, they had 32 kids sign up for it on October 1st. From in that 1 month period of time, they had 1,233 text messages sent by the kids. At winter school, they had 38 subscribers and they had 4,139 text messages sent. I think that speaks volumes for how it is at least giving the kids an outlet. Hayward School hasn't started yet. They'll be onboarding sometime in January due to all of the construction and everything. They had kind of a lot going on. Just work in progress. We have the Prevention Coalition that is with LCO and Sawyer County. And we're actually working to provide an in-person community presentation at Seven Winds Casino that will be about fentanyl and Narcan and quite a few different subjects. So we're working as the Prevention Coalition to go ahead with that next year. We're also working to put together a recorded presentation for the fentanyl so people who can't get out of their homes will be able to go online and watch it. We have radio ads that we've chosen for next year. Our focus right now for the next few months is going to be on stigma. So we are working up a plan to address that. We are also working still on the jail survey. And our recovery coach has been busy. At this point, he's just creating a manual of services and we're meeting with other recovery coaches in the county. The last two things I'll tell you about is we just forwarded a notice to all of the schools. The Substance Abuse and Mental Health Services Administration, SAMHSA, is doing a contest for kids. And it's empowering youth to safeguard against fentanyl. And they can come up with ideas to reach kids and to keep kids away from drugs. And the top 6 ideas actually get a $5,000 prize. And up to 25 kids will also receive $2,000 honorable mention. On a smaller scale, we are doing something fairly similar, probably starting in January or February. So with Forever Joy, the website that Kim Dale has put up, she has started a campaign called Create Your Joy and goes around to people and asks them, how do you create your joy? So Mr. Olson at the school was one of the first. And so he just says, I create my joy by riding my motorcycle and doing this and doing that. So we are going to have a Create Your Joy campaign for kids with a small prize for those that can be the most creative that we're putting together. That's all I have. Any questions?
Does anybody have any questions? So the text messaging, so who's responding to that or how does that, where does it go?
Yeah, it goes to the School Pulse staff and the people who are responding are licensed professionals. So if kids are, typing, like my example always is my brother is using drugs and my parents are fighting and I don't know what to do. So those kind of texts, they're all going to licensed professionals at School Pulse who then respond to them and help guide them through that process or get them to help if they need it.
And I assume everything is confidential, obviously.
Yeah, I mean, the schools can choose whether or not they can actually see the messages, but they would not be able to tell who the messages were coming from. So, and for us, we're mainly looking at the data of are the subscribers going up, going down, and are the texts being used? I think the numbers we were a little astounded by the numbers. So
is there any way to track whether this is being effective? I mean, as your texts go up, I mean, you're reaching more students, obviously.
Right.
But can we track on the backside is this effective in any way with reducing,
Right.
stress on these kids or chance of suicide or chance of drug use? Is there any way or matrix that we could use to do that?
I think the only way is going to be to follow this over time and see what the trends are, where the patterns are with the kids and what's going on with them. And that's a pretty hard data point to isolate,
It is. Yeah,
So,
okay.
but maybe, that gives me an idea, just talking off the top of my head of maybe doing some kind of a survey in 6 months or 9 months and see what they have to say.
That would be great.
Yeah.
Okay. Anybody else have anything? Okay.
Right.
Just one other thing I wanted to just say too, about the fentanyl awareness campaign, which I think has been wonderful. You guys did a fantastic job.
Thank you.
I have had some comments and they weren't negative, but within the tribal community,
Mhm.
the stereotype of the young blonde, girl that you had a original flyer that was really nice that had a whole bunch of different tribal members, I think, that had passed and Hayward member, more multi-diversal.
Actually, that flyer is not from Hayward. That
Oh,
is a national flyer called the Voices of Fentanyl.
okay, because that was originally part of the original presentation, right? And it was really nicely done, yeah. And it actually had quite a bit of Native Americans on it, so, yeah. So
We
I'm
actually,
not complaining, I'm just saying that
No.
I've got a little impact that people have been telling me it'd be nice if it could be somehow tailored a little bit, and especially during presentations associated with the tribe, that a little more to their culture, in other words. So just,
right.
yeah.
No, noted. I will say two things. That's part of why we're working with the Prevention Coalition to put this presentation together. And at the very beginning of all of this, when we were coming up with the optics for all of this, we did go to all the members of the Prevention Coalition and asked for anybody to come forward to put a local Native American on that. We wanted Native Americans on those optics also, but no one came forward.
Okay.
So,
Yeah. Well, I really appreciate the efforts. It's been a wonderful campaign, so it
Thank
was
you.
not negative in any way, but
Yeah. no, thank you.
thank you. Okay, anyone else have any questions related to Health and Human Service? Okay, if not, we'll move on to community service updates. House of Hope.
House of Hope, we still have one bed available at the moment. After talking with them, they most of the stream is coming from the jail ministry that they're doing there and stuff like that. And they actually, Mike here, likes the focus going towards the jail and trying to help keep them either from going back in, or if they're in a case at the moment, or to help them find a way to move it from having another case come up for them in the future. And so they like having that pipeline going there and keep working that. But at the moment, there's one bed available. Any questions about the House of Hope?
Do you have any idea what's happening with New Reflections?
Very little. I know it from what I've heard. I don't know too many details, but there is talk of trying to breathe more life back into it, or see what can be done. It seems like it does need a boost, and they are doing some remodeling. There were rooms that couldn't be used, and the roof need to be replaced and things. So from what I have heard in discussions is as a whole is being looked at and seeing what can we do to boost that up, because House of Hope is showing good results and good things in the community and stuff. So everybody's trying to pool together.
Would that be a potential place for warming
Safe
house?
place.
Yeah.
It's been discussed and we've gone in and looked. Biggest thing with Safe Place right now, we come across zoning issues. Because everything, for a homeless shelter to be, or a home or a warming house to be of any use, it needs to be close to the community. We don't want to be, oh, you're in town, now let's bus you 5 miles from town. So zoning issues, we have been getting together and we come up with plans every time something's potential, and then walls. But we're not giving up hope, and we're going to keep pushing forward. And like I said, as everyone pops up, we find a new way of, or here's something we do need to address and follow and, but small steps, and at least we're all, and all of the groups are working together. We're trying to get, even with, what's the, New Life Resource Center?
Okay.
We've talked with them and stuff, for like the women that are homeless and things. So that's the nice thing. There is all of them in here trying to do everything together and see what we can do that can help.
Great. Okay. Thank you very much. Does
Yep.
anyone else have any questions of Grant? Okay, thank you. Moving on, LCO representative update. I think Mr. Trepanier.
Yeah, I think we'll start with introducing our new tribal governing board representative on this committee, Mr. Bill Trepanier. I'll let you speak of your past and.
Yeah, hello, everyone. As Tweed said, my name is Bill Trepanier. Most of you, or some of you do know me. I apologize, I didn't bring anything to share with everyone today. Kind of got short notice. Tweed neglected to remind me. And
I brought him.
but if Tweed has anything to say, I'll
Yeah.
allow him to have some time. And then I do want to say I will have things to update in the future. So thanks.
Well, let them know your position prior to being elected, Bill. I think that was very important to this
Well-
committee and why we chose you.
Right. Well, some of you know me from this committee before. I was actually in attendance. I was the magistrate at the LCO tribal court before I came on board on the governing board. So kind of fits in my wheelhouse a little bit.
Mhm.
So I do have stuff to add.
And I think one thing we can add is that Lakuta right now has completed our 40-unit apartment building, and that is currently filled, correct, with 1 and 2 bedroom units.
Yes.
It's done a lot for our homeless problem. We no longer secure motel rooms in town, so I think even the sheriff can admire us of that, but we really made some moves there. We have secured funding in our new budget for a public defender, correct? And
correct.
we're in search of putting that program in place because we know of the shortage of that. So we welcome Justice Point and their office space set there. I know they stay busy and they're there when we're open, right, Becky? So we're just moving forward slowly, but things are getting better.
Absolutely.
Wonderful. Well, I just want to say thank you and and welcome to the committee.
Thank you.
I think you'll be a great asset. We really appreciate you.
Thank you.
And
Oh.
the housing facility is a wonderful, wonderful
Yep.
program out there. To complete that is huge.
Yep.
So,
And the tribal governing board does recognize and relates to the lower jail population now and the second judge and how that process is working. We support it wholeheartedly and we're just impressed with how it's working. We kind of had planned it that way and we supported it all along and now we're seeing it. So we appreciated that.
okay. Anyone else related to this? Okay, if not, future agenda items. Lynn, I think we'll put in just to review the bylaws as they are corrected back in January, so we make sure we're on the same page. Anyone else have anything else for future agenda items? Maybe we could put an update as far as the training grant also, just to come back and having looked at that contract, whether or not we can be moving forward with that. We just put that as an update item. I think Andy can address that. Anyone else have anything? Okay, if not, move on. Correspondence, reports, conferences. Anybody been anywhere exciting? I know Becky went to San Diego, and so did I. So, no. All right, I guess we're adjourned, and happy holidays to everybody, and I really appreciate this committee and the work that they do. Thank you.